In a bold move acknowledging the challenges in health services, the Premier of New South Wales, Chris Minns, has committed to significantly improving the hospitals in Western Sydney, noting that the current state of care has not been good enough. This declaration is especially striking, highlighting a crucial issue that affects many families in the region. But here's where it gets controversial. Despite ongoing concerns from the community and calls for a thorough investigation into these hospitals, the Premier has opted to push forward with infrastructural developments instead of inquiry. At a recent event unveiling an artistic vision of the ambitious $2 billion Bankstown Hospital set for completion in 2031, Minns emphasized his administration's determination to enhance health services. The planning for this project began under the previous Berejiklian government in 2019, but it took until this year to finalize the site. In a notable commitment during the June budget, the Minns government allocated an additional $700 million to this project and earmarked $100 million for relocating the TAFE that currently occupies the space. The Premier referred to this as the largest single investment in public health infrastructure in the region, a testament to the urgent need for improvement in health services as Western Sydney grapples with rapid population growth across areas like Mount Druitt, Blacktown, and Rouse Hill. We recognize that health services have lagged behind the needs of our growing community, and our goal is to elevate standards dramatically, Mr. Minns explained. He emphasized that achieving meaningful improvement will require both considerable investment and the necessary time. Health Minister Ryan Park chimed in, referring to the new Bankstown Hospital as a potential jewel in the crown of the regional healthcare system, and confirmed that construction is expected to begin next year. Features of the new hospital will include an expanded emergency department, additional operating theaters, enhanced clinical spaces, a dedicated mental health facility, and improved maternity services. Yet, the urgency of these developments comes at a time when the latest statistics paint a grim picture of the existing hospital system. Reports from the Bureau of Health Information indicate that hospitals in Western Sydney have been under tremendous pressure in the spring months. For instance, patients at Blacktown Hospital historically spend a median of 5 hours and 22 minutes in the emergency department, with some individuals waiting over 19 hours. Meanwhile, Westmead Hospital's situation is equally concerning, with a median wait time of 6 hours and 12 minutes. As 1 in 10 patients endure waits of 20 hours or more. In contrast, Bankstown Lidcombe Hospital has managed to keep its emergency department wait times more reasonable, with a median of 3 hours and 43 minutes. Although more than half of the patients still do not receive timely treatment. Emergency physician Nicole Delat, who works at Bankstown Lidcombe, expressed the intense emotions felt by staff, stating, "It often feels like we're packed to the rafters. We've dedicated ourselves wholeheartedly to our work this winter, and it has felt overwhelming at times." Dr. Delat genuinely believes the new facility will provide an environment that allows them to serve the community better. Interestingly, the government points out that there have been some improvements, including a reduction in the phenomenon known as ramping, which occurs when paramedics are delayed in transferring patients to busy emergency departments. At Bankstown Lidcombe, for example, 86% of patients are now handed over to emergency department staff within 30 minutes. A notable improvement compared to this time last year. Premier Minns acknowledged that, while progress is incremental, they are indeed turning the dial on hospital performance. The opposition, however, remains skeptical. As a counterpoint, they assert that the announcement regarding the Bankstown Hospital is just a collection of pretty pictures that fail to address the immediate crisis. Opposition leader Mark Speakman contended that instead of unveiling plans for a new hospital, The Premier should have prioritized launching an inquiry into the distressing outcomes occurring in local medical facilities. Speakman lamented the absence of tailored investigations specifically targeting Western Sydney hospitals, asking pointedly, what is Chris Minns concealing regarding the healthcare issues in Western Sydney? Moreover, Shadow Health Minister Kelly Sloan amplified the call for inquiry, referencing alarming reports of patients being forced to sleep on floors, which she believes warrant a thorough investigation. She criticized the Premier as using avoidance tactics, claiming that Western Sydney's residents rightfully expect and deserve far better care than what they are currently experiencing. So the question remains, do you believe additional inquiries into the Western Sydney hospital system are necessary, or should focus remain solely on development? Your thoughts could shed light on an issue affecting many families. Let's discuss.